I'm Neil Thornbury, CEO of TJ Regional Health. As I mentioned in my last update, I'm going to continue to provide information to the community periodically as we have information to share, and also address some of the questions we know you may have. I know there's a lot of information being shared from many sources, and a lot of projections as well as speculation. But what we want to share with you are the current facts. One of the most frequent questions we have received is, have we had any positive cases in our health facilities? To date, we have tested 35 people, we've had 28 negatives, and 7 tests are pending. I want to assure everyone that when we do have a patient test positive, we first have to share that information with the state and federal agencies, but we will communicate that information to our team members, our medical providers, and to the public as soon as possible. We will absolutely protect the privacy of all of our patients, but we feel like this information is very important to share because it impacts our community. Another question we are frequently asked is, where and how can I get tested? We are asking everyone who feels like they have any questions or concerns or showing any symptoms to call first. Please call the hotline number at 270-651-4400, which is staffed 7 days a week by registered nurses. They will answer any questions and direct you to the right resource if needed. We are doing corona testing at both of our hospitals, TJ Sampson and TJ Health Columbia, as well as our outpatient facility, the TJ Health Pavilion. Our medical providers will follow experts from the Centers of Disease Control's criteria for testing to determine if you meet that criteria for testing. If you are tested for the coronavirus, then please assume that you are positive for the virus. If you are sent home, immediately isolate yourself from the public and even from the family members in your own household. Our team will contact you as quickly as we receive the results of the test. Another question we hear frequently is the hospital ready? The good news is we have been very fortunate because unlike hospitals in other areas of the country, we have had more time to plan and to make preparations as we have learned from others on best practices based on their experiences. We have plans in place and we have contingency plans that we can implement depending on our level of impact. We have performed mock trials in our hospital and are reviewing research every day in order to do and be well prepared. We have also been preparing externally by working with our local emergency management center, law enforcement, our local government entities, and many others. I share this with you in order to reassure everyone that we are working diligently every day to prepare for this coronavirus outbreak. I'm sure there are more questions out there, and we will continue to address them as we hear them. Right now, I want to extend a very sincere thank you to the community. The responses have been amazing. We have had people reach out to us and ask, how can we help? We've had tremendous turnout yesterday at the blood drive that we hosted at the Pavilion, and the next blood drive is April 8th and only has a few appointments remaining. Many people have donated supplies, such as gloves, and multiple groups have offered to sew masks for our employees just in case we run out. Now, the random acts of kindness that we are seeing have been almost overwhelming. This makes us very proud to live and serve in a community with such kindness and compassion. I now want to address some of the things we've put in place to help the community. As I mentioned earlier, last week we launched the local hotline staffed with registered nurses. This week, we launched a new telehealth platform in all of our provider clinics so that if a patient needs to see their doctor for any reason, they can do so through this technology. Our online bill pay system is up and running so that you can pay your bills conveniently. And we know this is a very challenging time for our community. So as a result, we are extending our 25% prompt pay discount deadline from April 15th to July 15th. As a reminder, we are also implementing a very strict visitation policy at our hospitals and the Pavilion. Now we know this is a very difficult time because you want to see and support your loved ones who are sick. But we also know that you understand the significance and the seriousness of this situation. We've restricted visitation specifically to protect our patients, to protect you, and to protect our staff through this entire process. The coronavirus is extremely contagious, and we want to limit any possibility of exposure in our facilities to protect all of us. We truly appreciate your patience during this most challenging time. I want to briefly address social distancing and why it matters. I'm sure you've heard the Governor Beshear speak about social distancing and the Healthy at Home initiative. The two proven techniques to help slow the spread of the virus are strict social distancing and excessive hand washing. I'm in absolute agreement with the Governor that staying at home is the best thing you can do to help slow the spread of the virus. Please use the technology you have available to visit with your family and friends by phone, text, FaceTime. Utilize curbside pickup at your grocery store or pharmacy if you can. Do what you can to distance yourself from others. And of course, practice exceptional good hand hygiene. And finally, we are hyper-focused on the health and safety of our patients and our staff. We don't know how long this is going to last, but I can assure you, as always, we will do everything necessary to provide excellent care to the communities we serve. Thank you.